Hi everybody, this is Dr. Echols. We're back again, and on this video we're going to discuss a little bit about neck pain. Neck pain is very prevalent in our society. A lot of people suffer from it, and they have issues that maybe they don't even realize are attributed to their neck pain. Like they'll get pain radiating down into their arm, their elbow can sometimes hurt. They'll develop wrist problems, and oftentimes they'll think they have carpal tunnel syndrome because maybe they type a lot or they're very manual with their hands. So they may mistakenly think they have carpal tunnel when in fact the problem is coming from the neck. They can get numbness oftentimes in their fingers, and again, they can oftentimes attribute that to carpal tunnel. But the nerves from your neck, they radiate, they come right directly out of the spine and they go down across the shoulder, through the brachial plexus here, into the arms, and all the way down into the fingers. So there can be a whole host of problems that can occur when you have these pinched nerves or problems up in the neck. Also, the nerves from the neck, they go back up into your eyes, and they go into the sinuses here, and then they radiate back up into the head. So oftentimes people who are getting headaches, especially very frequent headaches, may not realize it, but they are coming from their neck. A lot of times my patients will come in and they'll go, I have all this tension and pressure back here, and when it gets bad, I'll get a headache. Well, that's a sure sign that we're having problems in the neck that are radiating along those course of those nerves and causing headaches to occur. Some people will get sinus problems as a result of the nervous input that the sinus is not functioning properly, and they can start developing different kind of allergies or sinus issues. I've had patients that when we relieved the nerve pressure on the table, their sinuses immediately opened up and cleared up. So there's a definite correlation there. And you can read all about that in Gray's Anatomy if you want to, but it's a little beyond the scope of this video. I actually had a patient once who had his eyesight restored with a chiropractic adjustment. How can that happen? Well, the nerves, the optic nerve comes directly, from the nervous system, and if there's pressure on that nervous system, it can actually interfere with the ability of the eyes to function. So I've had people tell me their night vision improved, and in this case, the guy actually got his eyesight restored. But we want to talk a little bit about some of the mechanisms of neck pain and what can happen and how to go about treating it and causing it, because it can be really debilitating. Especially, we've got busy lives, we've got kids to take care of, we've got our jobs to do. We don't really need anything interfering with that. So let's talk a little bit about some of the mechanisms that can happen here. When you're looking at a neck from the front view, the spine should be perfectly straight. You would be amazed at how many of my patients come in, and when I look at them from the back, their head looks like this. You just look at them, and they got one ear way up here and one ear low here. And I go, stand up straight, and they say, I am. Well, that's a real good indication that there's some curvature in the spine. If you look at the head, you can see how tilted it is. Here's one ear, and here's the other ear. So we know that there's some imbalance there taking place in the spine. As that imbalance happens, the spine will actually start to try to adapt to that, and it will start to create arthritic changes or degeneration that takes place in the spine. And you can see this on the x-ray. The little spurs will start growing, little calcific spurs will start growing down, and it'll try to lock that spine down to try to protect it. One of the other ways things that can happen to a spine is if you turn the spine to the side, you'll notice that there's a natural curvature in the spine. That's actually the way it's supposed to be. And the reason that is because when the baby comes out, when you have a baby, and he starts to lift his head, it actually develops a curve. It's called a lordosis. It develops in there because he's lifting his head and he's crawling around now. So that curve is actually supposed to be there. It's part of our natural development. And this curve actually protects us from shock and stress and strain because it acts like a spring. It acts like a shock absorber. You can imagine what the ride would be like in your car if you took all of the springs and shock absorbers off. It would vibrate the car apart and it wouldn't last very long. So oftentimes what I see in my practice is that the neck has actually, for one reason or another, has straightened out. And they've even given this a name. It's so common. It's called forward head posture. And if you want to do this at home, you can just take and look at somebody from the side and just look and see if their head is over their shoulders like it should be, or is their head way out in front like this. This is called forward head posture, and it looks like this on a spine. Now what that does is it puts a whole lot of strain because you're trying to hold your head. If you've ever gone bowling before, it's not so hard to hold a bowling ball right here, and your head weighs about what a bowling ball does. But just try to hold it out here, and it gets very heavy, and you have to really strain with these muscles to hold it up. So when your bowling ball, your head is way out in front here, these muscles have to continually work and strain just to even keep you erect. So we want that neck to be over this. How does your neck get into position like this? 1,000,001 ways. The first way I know about is at birth. If there was some sort of difficulty in labor and they use suction devices or they put too much forceps or forces on the spine itself, it can cause damage to the cervical spine there. Think about all the times the baby slips and falls and hits his head on stuff, and then as we grow up, we have our bicycles and we run into stuff. And I think the Occupational Safety and Health Administration estimated that I think there's over 10,000 traumas to the spine before we're even 11 years old. So there's a lot going on there, and some of these traumas are not just minor ones, they're pretty bad. Sometimes we get in an automobile accident and we're just kind of sitting at the light and somebody comes up and hits us from behind, and when that happens, the spine is whipped like that. That's why they call it a whiplash, and it goes straight like this. And oftentimes that can set the person up for years and years and years of problems. Oftentimes these can be corrected with chiropractic adjustments by gently starting to reposition the spine back into the normal position, taking the pressure off of the spine, off of the muscles, and off of the nerves. So big problems, headaches, neck pain, arm pain, all can be originating in the neck here. And I'll show you a couple of just real simple ways that we can go about correcting these problems without the necessary for drugs or surgery, which can be a real problem. By the way, to back up a little bit with headaches, they call normal having 1 to 2 headaches a year. A lot of my patients, when they first came to see me, were having 1 to 2 headaches a month, a week, or even every day. That's completely not normal, and if that is happening with you, I want you to realize that that is your body's way of trying to get your attention that there's a problem. And suppressing those symptoms with non-steroidal anti-inflammatory drugs like aspirin or whatever is not going to solve your problem, and it's going to create more problems down the road. So I would really encourage you to try to find out what's actually causing those problems and get it corrected. Okay, one of the ways that the doctor can determine whether you have a nerve that's being irritated or pinched in your neck area is by doing just a couple of real brief, simple orthopedic tests. And I'll show you one right now. This is called the cervical distraction test. And what I'm going to do, this is Miss Corrina, she's going to be brave and help us out today. We're just going to lift up lightly on her head like this, and we're going to ask her, does that feel better or worse or no different when we do that? Now, oftentimes, if the person has a nerve that's being pinched, they'll go, oh, that feels a lot better. Now, what that means is that there's compression on the spine itself. There's pressure on those nerves. And when I lift up, it's just like taking, standing on somebody's toe and then stepping off of it. It feels really good. So she's going to tell me it feels a lot better. That's a real good indication that we've got some problems up in the neck area. Now conversely, if there's a pinched nerve in the neck and we put some pressure down, just light pressure like this, a little 5 or 10 pounds of pressure, if there's a pinched nerve there, she may report that it's not comfortable. She can feel either a sense of discomfort or, frankly, just pain when we do that. And that's another indication that there could be some pressure on the spinal nerves there or on the vertebra. If that doesn't elicit pain, we'll tilt the head to the side and we'll actually put a little pressure down here like this. And oftentimes if the pain or the problem is localized on that side, the patient will let you know, yeah, that's really uncomfortable when you do that. Same thing on the other side. We'll put some pressure down like this. Now my little boys, they used to actually, when we'd be roughhousing and playing, they would actually come and sit on my head. And they weighed 100 pounds, 60, 80 pounds, whatever. And it wouldn't hurt at all because I didn't have any problems in my neck at that point. So But if you do have problems and you put just that light pressure down there, it will normally elicit some problems in there. And then that can be taken care of. So just like we talked about in other videos where we have problems with the facets, which is where the vertebrae come together, that can be an issue in there. It can also be that the vertebrae are been rotated and they're just not able to move and work the way they should be. And when that happens, we'll start getting a lot of tension throughout these shoulders. And almost everybody comes in and tells me, "Oh, Dr. Echols, I just carry all my stress right here." Well, what that means is that you've got pinched nerves up in here in your neck. Those nerves are firing. They're always firing because they're being irritated. Those nerves are connected to these muscles. And so when these muscles work on electricity, and when they get the nerve impulse from the firing nerves, they contract like this. The more stress you get under, the more these contract, okay? So the secret is to not get rid of your boss or your husband or anything like that. It's to actually get the neck corrected. That'll take care of the headaches and a lot of this tension that goes throughout here. Especially, and when you start to develop pain that radiates into the arm, I want you to know that's a much more significant problem. It means that it's been there for much longer and it's more serious and it needs to have attention right away. So I'll show you just a real gentle way that we can help to start correcting these problems. All right, Miss Corrina has volunteered again to help us. And what I'll do, this is called palpation. Palpation just means that you're actually feeling of the spine. And chiropractors are trained extensively in school to palpate the spine and determine what kind of position it's in, whether the spine is rotated or extended or if there's some sort of abnormality there. And the fingers get quite a bit of sensitivity after doing this for many years. Miss Corrina, can you feel that there's some tenderness on this side? Yes. Over here? So what I can feel is that her vertebra, if you picture it here in there, is rotated this way. Now when that happens, of course, some of the muscles are going to get loose and some of them are going to get taut. And she'll develop tension here in the neck and in the shoulders. Also, she may start to develop headaches or other issues because that nerve is being pinched. So when you have a vertebra out of position, it doesn't really make sense to medicate it because it won't do any good, except maybe temporarily make the symptoms go away. In order to correct these problems, you have to put the vertebra back in the right position.